Hi guys, welcome back to my YouTube channel. My name is Adedoyin. This is your first time here. I make videos around lifestyle and health. And if this is not your first time here, thanks so much for coming back. It means so much to me. Yeah, if this is your first time, don't forget to hit the subscribe button if you like what you see or if you enjoyed this video, and yeah, and also give this video a like if you enjoyed this video. Today I'm going to be talking about the best birth control methods for females, and I'll also be talking about understanding your cycle and yeah, just preventing STIs and pregnancies as much as possible. So there are two methods of preventing pregnancy. We have the barrier method and we have the hormonal method. So the barrier method involves using a barrier, and these kind of barriers are like, number one, the male condom, and two, the female condom, what we call the diaphragm or the cervical cap. Now the male condom is simply one over the male penis. It's easy to use, affordable, and it's just simple. The female condom or the diaphragm, on the other hand, can be very tricky to use, so it's always safer. If you're not familiar with it, it's safer to just go with the male condom. The male condom is 98% effective at preventing pregnancies if used right, and it's the only known way to prevent STIs because it's a barrier method. Compared to the other form of contraceptives that only prevent pregnancy, the male condom actually does prevent STIs, because what it does is prevent the bodily fluid from the male and female from coming into contact. Now to the hormonal method. So now under the hormonal methods we have several options. There are the pills, and for pills we have the combined oral contraceptive, the combination oral contraceptive pills, and we have the progestin only. So basically the combination contains two types of hormones, estrogen and progestin. The progestin only is just progestin, and basically these pills involve using a tablet every single day of your cycle. So what it does is just mimic certain hormones in the body. For the combination pills, they mimic certain hormones in the body that make your body feel like, oh, you've already ovulated. And if you or you've already ovulated, basically. So if your body feels like you've already ovulated for that cycle, it's not trying to release another egg. So basically your body doesn't release egg, it stops ovulation. That's how the combination oral contraceptive works. And basically you use it every day, and its effectiveness depends on how compliant you are with it. And for most hormonal contraceptives, if you are compliant, like you use it the way it should be used, it adds up to as much as 99% effectiveness. So usually for most combination pills, they have a 21 days of active pills that are put in the caplet. I'll put pictures up here. 21 days of active pills when or hormonal pills, while the remaining 7 days, which is like 28 days, that's 4 weeks, the remaining 7 days are like placebo or iron tablets basically. So during that period you bleed as normal, and then when you complete that 28-day pill, you start, and the next day you start another 28-day pill again. So that's how basically oral contraceptive pills work. You have to take them every single day for them to be effective. The next option is the implant. So this is the arm implant. I'm sure most people are familiar with this. So this is just a progestin hormonal implant as well. It contains progestin, so it's inserted into the medial part of the arm, so it's put there and it can last as much as 3 years. The side effect of the implant is that your period might make periods. Most people complain that it makes their periods irregular or infrequent or sometimes prolonged. Also, I hear people say that they don't want to use contraceptives because it reduces fertility and all that. But apart from one method which I'm going to mention, which are the injectables, the other forms of contraceptives actually do not affect fertility. Once you discontinue them, immediately your body is as fertile as it was before. Now, bear in mind that as a woman advances in age, it's only natural, fertility declines. So sometimes people go on contraceptives and then later on they take it off and they feel like, oh, okay, it's the contraceptive that has affected their fertility. But I mean, age, you've gotten older, it could just be your body's natural response. Yeah, so that's just something to note. Another hormonal contraceptive is the IUD, and for the IUD there are two types. There's the copper IUD and there's the progestin IUD as well. This one just the copper IUD, what it does basically is that it's spermicidal, so they insert it through the vagina into the uterus, that's your womb, and it just implants on the wall there. It's toxic to sperm cells basically, so that's how it prevents pregnancy. The hormonal IUD also slowly releases progestin hormone, and causes the cervical mucus to thicken, which makes it difficult for sperm cells to swim through. And basically, yeah, that's that. The copper IUD set will be able to last up to as much as 10 years, while the other progestin IUD can last as much as 5 years. There are also transdermal patches, which are just like patches that you put on your abdomen every day, and it works almost like a pill. You take it every day, and then there are periods when you don't use it, where you bleed, and then you continue every day basically. Lastly, there are the injectables, which are the injections that are taken every 3 months, as your Depo-Provera and the likes. So these are taken every 3 months to prevent pregnancies. And I also remember saying that it's the only one that has been shown to affect your fertility. It said it takes about 18 months usually for fertility to return back to the way it was. Lastly, there are the emergency contraceptives, and they are called emergency contraceptives for a reason. The postinol, postinol 2, and the likes, after pill, whatever it is called, in or you're familiar with it as, contains levonorgestrel, and this is used only in an emergency situation. So in a case where you're not on any contraceptive, meaning any regular contraceptive, and you had intercourse that wasn't planned, then you use it within 24 to 72 hours of intercourse, and then it prevents pregnancy. But of course, the longer it takes, the less effective it is, meaning that if you take it at 24 hours or within 24 hours of intercourse, it's more effective than when you take it at around 48 to 72 hours of intercourse. So yeah, that's basically how that works. But it's an emergency contraceptive and should not be used every day. I've heard of people abuse it. It should not be used every day. If you want a more sustainable form of contraception, then you should talk to your gynecologist or your doctor. And lastly, understanding your menstrual cycle is very important. I mean, 5-10 years ago, if you didn't understand your cycle, you didn't know how many days or all the length of your cycle was, or you didn't know, or you could not remember your last menstrual period, I mean, maybe it has been accepted. But in this present day and age, there's too much information at our disposal. You should know this basic information about your body. Like, you can't go to a clinic and then your doctor asks you when was the last menstrual period, and then you don't have any idea, you don't have it written anywhere, you don't remember, you don't know what's the length of the menstrual cycle, you don't have any idea. I mean, it's not nice. Whether you're sexually active or not, as a female of reproductive age, those information is very important to remember. And last thing I want to say is the only sure way to prevent STIs is abstinence. And if you can't abstain, then they say you should stick to one partner, meaning both of you know you have no sexually transmitted infections, and then you both stick to yourself. So meaning just both of you have intercourse with each other, no extra partners. The other way is to use a condom. Like, use a condom, always use a condom, because condom is the only method of contraception that would prevent STIs. The other methods only work to prevent pregnancies. I hope I've made sense. I feel like I'm rambling a lot, probably because I've been off here for a bit. But yeah, thanks so much for watching, guys. If you have any questions, kindly leave it in the comment section down below. I'm quite sure I might have forgotten or missed out a few things, so if you do remember, of course, please remind me, and or if I missed anything, kindly correct me in the comment section below. Thanks so much for watching, guys. I hope you've learned a thing or two. I'll talk to you guys in my next video. Bye.